So I want to give you a couple of tips, tricks, exercises for SI joint stability. And if you're watching this, so number one, I'm assuming you have a proper diagnosis of the SI joint, the sacroiliac joint. And number two, you're either getting it adjusted and you know the alignment is good and the motion is good. And now that the bones and joints are moving properly, we want to get that muscular component fired up to get you active. So we talked a little bit about earlier about the SI joint. So that's the back, that's the lowest part of your low back and your pelvis, and how we have to tie in exercises that get your glutes firing, so get your bum muscles working, and they get your back working as well, right? And so I'm going to just show you 3 quick exercises that you can start doing right away to activate those glutes. So one of the biggest buzzwords in rehab over the last couple of years is you have to activate muscles before you load them. So what that means is we want to see you squeeze before you move. And I'll walk you through that with a little more detail, because the first thing I'd love you to do, you're going to lie flat on your stomach. Okay. What I'm going to ask you to do is you're going to bend one of the knees, so it's going to shorten up your hamstring. And before you lift your leg up, okay, you're going to squeeze your glutes. And so you're going to squeeze your glutes, and a good visual is you're going to squeeze a quarter between your butt cheeks. Your muscles are going to turn on, and then you're going to lift your knee up just an inch or two like so. Okay, so back down, relax. You can do 12 to 15 of these per side, but again, you're going to come up, you're going to squeeze the muscles first, then you're going to lift off. Okay, once you've got a good handle on that, great exercise for glutes and SI are your supine bridges. And I think everybody knows these, but the same thing would apply. You're on your back, you're going to squeeze your glutes first, and you're going to bridge up. You're going to hold, and then you come back down. Okay, you can do these with both feet on the ground. You can do it with one foot on the ground and one extended if you want to make it a little bit harder. But I always say start easy. Do your 12 to 15 with both feet on the ground before you progress. The very last thing, and I teach this in the core class here every couple weeks, is bird dogs. So again, we want your glutes activated, your spine neutral, and you're going to lift one leg nice and straight off the floor. Okay. As you lift the leg, once you get really good at this, you can also extend a hand. And in that way, your upper body and lower body are crossed, and that's probably the number one exercise to get your SI joints functionally strong and stable. I hope that helps you on your journey to keeping your body active and mobile, because what I know is SI joints can cause people all sorts of problems, and these should help you a ton. Thanks, guys.